Right. Blair, can I confirm you're not seeing presenter mode?
Correct. It looks good.
All good. Okay. So I'm going to dive in, and I already know that I'm going to be talking really fast and I'm probably going to run out of time, but I'm going to do my best to cover a lot of things and hopefully have some time for questions at the end. And if not, if we run out of time in the hour, I'm happy to stay after and chat as well. So, just quickly about me, I'm an SLP. I've been in practice for over 12 years. The last 7 plus have focused on stuttering. I'm currently a clinical faculty member at Boston University, and I'm the director of the Center for Stuttering Therapy there. We see clients across the age span, across the lifespan, preschool up through adulthood. Prior to joining BU, I was in a multidisciplinary private practice where I had my own caseload of across the lifespan clients who stutter. And I'm in the board specialization process for the specialized certificate in stuttering, cluttering, and related disorders. So there's a lot to cover, and I think as a disclaimer, each of my slides could probably be its own separate hour-long talk, and I'm really just hoping to leave you understanding why and how we're shifting towards deprioritizing fluency and moving towards communication, competence, confidence, and advocacy for our clients. So my therapy approach is really a melting pot. So my aim in this webinar is to give you a sampler and some ideas to try, and then a lot of resources to pursue further learning if there's something that feels particularly interesting or relevant to you. I'm always happy to talk more about this. You have my email to contact me as things arise. So we're going to go over kind of current trends and a new definition, a variety of approaches to stuttering therapy, give you some goals and lesson plan examples, and then maybe some time for questions at the end. So we're going to start with how we approach the word stuttering. So language matters. We know that we're SLPs. If you don't define or describe something correctly, you're not going to get the right output. You're not going to be working with the right thing. So this is just an example of some AI images that didn't quite get it right. On the left is cupcake, and on the right is eggplant. And I think they're just funny examples of why the definition of something or how we describe something really matters. And so I'm going to start with talking about definitions of fluency and stuttering. So fluency at its core is the continuity and smoothness of rate and effort. And it doesn't mean just speech, right? Like we can have lots of different types of fluency. There's reading fluency, which we know is decoding, speech fluency, which is what we're really talking about when we talk about stuttering, and semantic fluency, which is like word retrieval or rapid naming. There's someone who writes about, fluency, surface level, and deep fluency. And he proposes that you can have fluency in any action. You could have rock climbing fluency. It just means that you can complete that action smoothly. So I think that we have kind of confounded fluency and stuttering. I'm going to try and break those things apart. I also want to point out that I've written disfluency with an I, not a Y, because when you spell the dis prefix with an I, it means a typical variation, whereas when you spell it with a Y, it means disordered. So that's a little shift that I've made in my own practice. We know that everyone presents with typical disfluencies, right? Those are mazes, word fillers, word repetitions, revisions, abandoned utterances, and that everyone is disfluent at times. If there are different demands based on the situation or how you're feeling or your proficiency of the language or your topic knowledge, right? That those things might increase your disfluency, but not everyone stutters. I think those are important distinctions. So this is like the Google definition of what is stuttering, and I purposely am titling this "What was stuttering" as I propose kind of a shift. This is from the Stuttering Foundation. It says, stuttering is a communication disorder in which the flow of speech is broken by repetitions like this, prolongations like this, or abnormal stoppages of sounds and syllables. There may also be unusual facial and body movements associated with the effort to speak. So noticing that this like Google definition of stuttering is really focused on what we as the listener see in those surface level features. So we're at this turning point, like kind of in our broader society, where I'm sure you've heard about the neurodiversity movement, and these concepts are familiar, but maybe it's a little bit newer how we're thinking about connecting them to working with people who stutter. So when we think about neurodiversity, we're typically thinking about the autistic movement. However, there is a proposition that we consider stuttering as a form of verbal diversity. We know that stuttering is a neurobiological disorder with a strong genetic component. So does this make it more of a variation than a disorder in the same way that we think about other brain differences? So this helps us to shift to thinking about viewing stuttering as a deficit, to viewing it as a feature of someone. And there's actually even kind of a proposal of viewing it as a gain, stuttering gain. What do you gain by being having this verbal diversity, meaning this other end of the brain spectrum in terms of fluent speech? So the neurodiversity lens proposes a shift in viewing stuttering and how we approach therapy as well, right? So we want to think about the kinds of interventions that we're using that should be person-centered with individual goals and promote overall well-being rather than striving for fluency. So these are things that we know, and it's hard to kind of put into practice, but we really want to think about goals that focus on ease and spontaneity of speech, not fluency exclusively. And we don't want to prioritize fluency at the expense of spontaneity, for example. There's a little bit of a difference in terms of person first versus identity first language. I think when talking with people who stutter and stutterer are kind of interchangeable. I also just want to point out the social model of disability and the contrast to the medical model. So I mentioned that I come from a multidisciplinary private practice, which is really rooted in the medical model, right? You need to identify the disorder in order to bill insurance for your services. So it can be challenging to shift to that social model when you're kind of rooted in that, and our field is rooted in that. But the social model really moves towards viewing that there's an equally important societal shift that needs to occur through legal protections, media representation, activism, and education and research, so we can understand and remove barriers, rather than the medical model that places the burden of work and change entirely on the individual. So the person who stutters needs to fix that, either become more fluent or accept it, but it's solely on them to figure out, versus a shift to the social model that's really thinking about removing barriers. And then also just noting ableism, which we know is discriminating against people who are not able-bodied. And I think that unintentional ableism can happen a lot during therapy. I know that I've been guilty of this myself, so it's not meant to be shaming, but just kind of to raise an awareness. Unintentional ableism might sound like praising fluency. Great job, you barely stuttered, or trivializing their experience. Oh, that one didn't seem so stuck. Right? So it's imposing our abled perception on the stutterer's lived experience. And I think that when a person who stutters has internalized that stigma and those negative attitudes due to stuttering, it can lead them to attempt or hope to attempt to mask their identity as a stutterer. And that can contribute to struggle behaviors, tension or avoidances, and that kind of adverse impact that we know. So I want to shift our thinking and shift our language. I think the challenge with the term fluency is that it's really determined by the listener. So it's the listener, not the stutterer, who's labeling what is stuttering. And that kind of creates this false binary of fluency is good and stuttering is bad, which perpetuates the stigma, which that stuttering is inherently bad. And our goal is not to strive to eliminate fluency, but to work on substance over style, and really prioritizing communication and moving towards easy stuttering. So I really like this article by Titchener and Yaris, where they actually asked people who stutter how they would define stuttering. So rather than, again, the listener or the outsider defining the experience of stuttering for them, asking adults who stutter what stuttering means. And these four themes came up as the most prevalent. And far and away, the biggest one was this feeling of a loss of control. So that the experience of stuttering is an experience of loss of control. They also reported feelings of anticipation or fear of stuttering, stuttering, variability in the presentation of their stuttering, and strong physical, emotional, and cognitive experiences. But again, they didn't note the blocks, repetitions, and prolongations as in their top four in terms of defining stuttering, the experience of stuttering. So we've known this for a while, that the experience of stuttering affects the stutterer on a variety of levels. So the personal level, thoughts, feelings, and behaviors, the environmental level through speaking pressures, stigma, and negative public opinion, and activity limitations and reduced participation in their environment. So we know that with stuttering, with many communication disorders, with stuttering as we're talking about today, it really goes so much deeper beneath the surface of what we see on the outside. So because of that, I think we want to redefine stuttering and move towards when a speaker feels a loss of control, right? So that the definition is based on that and almost doesn't matter whether or not there's been a disruption of speech on the surface, what we can see as a stutter. So moving to this definition, I think, helps us be more individualized. And it also gives the ability to consider those covert or less observable features of stuttering. So those word avoidances or starting and stopping sentences or working around or just reduced speaking and engagement in situations. So if we're thinking about loss of control as opposed to that was a block or that was a repetition, it makes us rethink how we're approaching our therapy. And again, it combats ableism by prioritizing the speaker's feeling and lived experience over the listener's perception. So this is a definition that I took from Christopher Anderson from his book, Every Waking Moment, which he published in 2023. Christopher Anderson's a person who stutters, and he spent a considerable amount of time really analyzing his experience of stuttering to pull out themes and his approach towards moving towards acceptance. And this is his definition of stuttering. So stuttering is a complex mental health and social identity affliction conditioned by one's behavioral responses to their individual lives, predisposed by neurology and genetics, or maybe not, that inflicts a traumatic life impact, is not solely impediments of speech, nor a terminal disability, but largely one of avoidance and shame, which is possible to marginalize and heal through awareness, action, perspective, and social connection. So this definition, I think, is so much richer than our immediate thought of stuttering as being about blocks, repetitions, and prolongations, and really focuses on the impact to the individual, as well as the path towards progress through awareness, action, perspective, and social connection. Okay, so I'm going to shift for a second now to this video by John Hendrickson. If you don't know, he's a journalist who was initially famous or in the spotlight for a piece that he wrote about Biden in The Atlantic, but he's since written a memoir, which is excellent. He's done a lot of advocacy and been on a lot of different platforms. So I'm going to share screen before I start playing it. Put the link to that. I just put the link to that in it's not a real device in the chat, and it's also in your handouts, but it's there in the chat as well. And so let me get my slides back up. Okay. Oops, it's not shared, is it? So I've used that video with clients of many different ages and had it been entire sessions of a lesson plan, pausing at different times and stopping and discussing and talking about what brings up for that client or what they think about the experience of stuttering and how it compares to him, what's the same or different. I think it's just a really great video. And I'm buying a little time because I'm struggling here with getting my screen to share in the right way. Okay. There we go. All good. Presenter mode. You're not seeing my notes. Okay.
Hey, Kim, we
Um,
are still seeing your notes right now, but it might be loading to the new version.
I'm just not sure why. Okay, I stopped sharing. Here we go. Let's try it again.
That looks great.
Awesome. Okay. Um, great. So I think, again, I love that video. I'd encourage you to share it with clients, with coworkers, with family members. I think that there's a lot to discuss in there. And I think that he does a really good job of exemplifying and describing this shift in moving away from fluency goals and towards communication and self-advocacy. So I want to talk about what we're going to do if we're making that shift when you actually have the clients in front of you. So um, we're all familiar with the iceberg analogy, and we know that the surface level is what we as the listener can see and hear, the disfluencies or the physical behaviors, and beneath the surface is what we can't see or hear, those emotional factors, which is a really classic way, I think, to visualize the overt or surface level and covert or beneath the surface features. And I like to think about our job as SLPs as warming the waters and kind of smoothing the edges of that iceberg. And that's what I'm going to be kind of describing. So there's a lot of information here, and my goal is to give you like the quickest snapshot of some tools and resources so that you can learn more. This is all in the quick reference guide, and everything with the exception of like the specific client examples are in the handout slides. So first, I'm just going to go through like a quick framing of what each of these different approaches are and the goals of working within this approach, and then I'll come back and layer on some specific and measurable goals and therapy ideas. So ACT stands for Acceptance and Commitment Therapy, but it's pronounced ACT. It comes from Australia and has been applied to working with people who stutter for about the past 10 years. The goal of this approach is emotional flexibility and to make life's discomfort workable. So recognizing that life is uncomfortable and we are always going to experience pain and discomfort, but how can you make it workable and livable? It focuses on helping the client identify like these core values. So thinking about the present, really being in a moment to acknowledge it, observe it, and let it pass. Focusing on values, helping the client work through what is important, what they really want out of life, and then the committed action to progress towards those values. So building the accountability partnership and that therapeutic alliance to really support the client in moving forward towards that commitment to pursue the values that matter to them. Self as context just means establishing a sense of self that's not all consumed by stuttering. So challenging a client's tendency to potentially view all reactions through the stuttering lens. For example, the barista laughed at me while I was ordering my coffee. He laughed because I stuttered. Maybe the barista laughed because the name of that Starbucks order is ridiculous and everyone has a hard time saying it. Or maybe he laughed because he has an earbud in and he's listening to something else while he's taking your order. So trying to break that tendency to be consumed by the perception of everything is through this stuttering lens. Diffusion, they refer to it as unsticking. So to unstick yourself or to help the client unstick from negative thoughts and experiences. It's a way of just reframing those negative thoughts and experiences. And then ultimately acceptance. And I think it's important to note that acceptance doesn't mean this like perfect nirvana. It's not like you're done and accepted, but you still have to work at it. And it's a process that takes time. And it's really just about making stuttering workable in your life and allowing you to still live your values while being a person who stutters. There's an excellent CEU course on this here. And a lot of the ACT materials are free and publicly available if you just Google ACT, not stuttering specific per se, but just you can then adapt them for working with your clients. Avoidance reduction therapy, or ARTS. The goal is to reduce self-stigma, increase effortless disfluency, and confident communication. So it really values struggle-free speech and the quality of disfluency rather than the frequency of disfluency, spontaneity of language, and long-term change. So here, the real goal is to work towards reducing struggle. So you're helping your clients reduce struggle by reducing efforts to hide their stutter, efforts to hide their identity, or efforts to control the form of stuttering. Vivian Siskin, who is the pioneer of this approach, has done a ton of work and published a lot. She has a recent article, 2021, that she adapted for the school age population, which is excellent. It's linked here, 2022, or not linked, but the name is there. If you can't access it, please email me. I'm happy to send it. It really is like a roadmap of what you could do with a school age child to approach through this lens. So ARTS really combines principles of speech therapy and counseling, and again, is working towards reducing those struggle behaviors. And when I say struggle behaviors, I mean more than just physical, right? It can also be emotional or cognitive struggle. And the theory is that removing these struggle behaviors results in spontaneous, forward-flowing speech. That's main goal is to convey meaning. And there's going to be stuttering, but that stuttering will be effortless or less effortful. And it's really also about changing attitudes towards stuttering, including acceptance and advocacy. Cognitive behavioral therapy, I think, is probably the most well-known. It's been kind of around the block in terms of working with stutterers through this lens. The goal is to examine the role of thoughts in daily experiences and to recognize that thoughts can lead to negative emotions or unwanted behaviors. So by identifying the thoughts that you have in this cycle of related emotions and actions, can you make changes in that cycle that might break the pattern? This resource is free. It's like an ebook that has a fantastic chapter on cognitive behavioral therapy, specifically in some, there are adult-specific examples, but it can be adapted, I think, for working with kids. So you're really working on identifying the kind of cognitive distortions and negative automatic thinking and reframing that through this lens. Mindfulness is, something I think that is integrated in a lot of these different approaches, but wanted to just give it its own sort of separate shout out. The goal of mindfulness is to pay attention in a particular way on purpose in the present moment and non-judgmentally. So we pause, notice habitual patterns, and make a choice in how to respond. And that whole goal and explanation is mindfulness, not specific to stuttering, but obviously there's so much carryover, right? Like to empower the client to be able to make a choice in how to respond to their moments of stuttering. We know that there's greater emotional regulation and reductions in stress, anxiety, and depression in people who regularly practice mindfulness. And there are tons of awesome resources. Those are just a couple examples of specific mindful exercises that you could do, which are at that link there, the stutteringtreatment.org link. And it really walks through and has YouTube clips embedded in for something that you could just add to a session tomorrow to practice any of those meditations. Solution-focused brief therapy, I think, is relatively new in its application to stuttering, and it's something that I've really adopted into my practice. So it has a history of theoretical development and application in psychology, and so we're kind of borrowing from that into our speech therapy field. And it differs from traditional approaches in that it relies on the client's ability to draw from their own resourcefulness, strengths, and problem-solving skills. So the goal here is to guide clients to explore their inner strengths, to identify therapy goals, and support their best hopes for a preferred future. It's based in positive psychology, which tells us that people are naturally equipped with the resources to solve their own problems. So we are helping our clients to find their own solutions through focused, goal-driven actions. It includes collaborative goal setting, eliciting best hopes, building self-analysis and perspective, a lot of scaling exercises, which I'll go over in a little bit, and developing the client's resourcefulness, again, so that they're not reliant on us externally, that they're their own independent internal motivators for change. This article is freely available and is also excellent. SFBT in public schools, children solve their own problems. It's PEDS focused. It's one of the best that I've seen that is PEDS focused and is specific to stuttering and has a lot of excellent examples. I'll walk through one in a minute, but you could have a whole semester's worth of therapy just from that article. So then stutter affirming therapy is probably the newest one on the block. And it's more of a like theoretical mindset than a specific like course of action. But the goal is to develop positive stuttering identities and to help clients develop control over their reactions to stuttering. So it's not developing control over their stutter, but how their stutter impacts them by helping the client to learn to stop forcing fluency or striving for fluency, helping the client to learn to value stuttering, perhaps even this idea of stuttering gain. What do you gain by being a person who stutters? What would you lose if you were fluent? And helping the client to learn to cultivate an environment where they are comfortable stuttering. So both identifying what makes them comfortable and at ease, and then the ability to advocate for themselves for that across different contexts. I love the Stuttering Foundation podcasts. They're awesome. Those two in particular, I think, are really great. The second one, What Would Stuttering Be Like If We Wanted to Stutter, is by Chris Constantino, who is the researcher and faculty member and a person who stutters at Florida State, who really has been pioneering and writing about this concept. And that's his paper, Fostering Positive Stuttering Identities Using Stutter-Affirming Therapy, which is what he goes over in that podcast. Okay, so um, one of my goals of this presentation was to increase your awareness of stuttering and how important it is to shift our focus, right? So I'm hoping that increasing your awareness will help to combat the unintentional ableist views of stuttering that society unfortunately perpetuates. So just again, encouraging you to think about inclusive language and moving away from the narrative of overcoming stuttering to perhaps considering overcoming the associated resentment of stuttering or overcoming the fear of stuttering or the fear of talking, and moving away from really concrete and binary terms like worse or bad. This is something that with all of my clients of any age, I pretty early on in the therapy process, I'm working to shift. Someone comes in and says, oh, my stuttering was so bad today, or it was worse today than it was yesterday. Really diving into what do you mean by that? Was it more frequent? Was it more tense? Did it feel longer or tighter? Was it just in a situation that was really challenging for you and felt like high stakes and a lot of pressure? So it felt bad to be stuttering in that moment, so that we can be more descriptive and not just like it was good or it was bad. Working to challenge the stereotype, right? We know that stuttering is not caused by decreased confidence or anxiety. They may go together. There could be anxiety that is, intertwined with the experience of stuttering, but it's not the cause of it. And again, to reframe so that we're praising communication efforts rather than fluency. Thank you for sharing that with me. I loved hearing what you had to say. I really appreciate that you took the time and effort to get that out. What you have to say is really valuable. So I think for those of you in school systems or multidisciplinary practices, I think it's really important for the SLPs to be the ones, helping to spread this message and foster a community of support in your different contexts. So I think we have a responsibility to support these kids in different ways. There's, education, helping everyone understand that this is a difference, not a disorder. And again, moving towards that social model and away from blaming the individual. I think, all stakeholders, including the child, can be involved in the discussion about what self-advocacy looks like and what, they want to share and how they want to share it. In schools in particular, I think there can be a tendency to perhaps excuse the child who stutters from group speaking in front of the class or group presentation or raising their hand, which can unintentionally reinforce that message of you can't do this or it's not something you're going to be good at. So rather working with the team in the system to think about how can we gradually approach those challenges or desensitize the situation, starting in a small group, moving towards a larger group, raising their hand in certain classes but not others, or things that feel comfortable for the client and being or the student being really individualized about that. Helping to build resilience, trying to listen to what is being said instead of how it's being said, and really enforcing positive self-image and confidence to solve problems. providing resources for peer groups. The National Stuttering Association and the Stuttering Association for the Young are excellent. And both of them have local chapters. Well, the NSA has local chapters across the United States. Both of them have some meetups and like monthly or so virtual meetups for different ages, if there isn't one that's local to you, which can be really powerful. And thinking about social change and possible anti-stigma or anti-bullying programs within your systems that could include stuttering as well. So just going to take a quick minute to acknowledge why this is our role, because I think it can feel a little bit overwhelming, right? Especially if you're, working across a lot of different disorder areas and ages, and there's so much that you're trying to manage. But I think that it absolutely is our role, and certainly we need interdisciplinary, collaboration. And when things extend beyond the scope of our practice, getting other individuals involved. But Asha says that clinicians support the thoughts, feelings, and behaviors that result from living with a communication disorder. And that's what it's all about, is really we're uniquely positioned to work with the emotions related to stuttering in a multidimensional, integrated, individualized, and child-directed way. And we know that best. So if we're, making this shift, we need to think about new goals. If we're no longer prioritizing stuttered syllables or speaking more fluently in certain situations, what are our goals? So some new long-term goals that I propose are decreased efforts to control the form of stuttering, increased spontaneous and meaningful communication, increased approach of feared words, phrases, or situations, increased positive associations with stuttering, increased self-advocacy, and increased participation. This is in your handout, so I'm not going to read all of them, but these are some sample short-term goals that I've written that kind of align with those long-term goals that could obviously be adapted depending on your specific client or student or situation. So I'll just kind of pause for a second and acknowledge strategies, because I haven't talked at all about stuttering modification or fluency shaping strategies. And, I think that there is a place. I am still teaching them in some, situations, but I think it's all about intentionality of how those strategies are incorporated. So if I'm teaching a strategy, it's always at the client's request, and it's always balanced with this emotional and cognitive work. And the end goal of therapy isn't fluency, and it's not the measure for discharge, but it is perhaps an additional thing that I'm adding in to just promote the ease of stuttering to increase participation. But Nina Reed said, if a client does not build a willingness to approach stuttering, most strategies are essentially worthless. And this is really how I approach it. I'm not just going to teach strategies unless there's also that willingness to engage with, approach, and move towards acceptance of stuttering. So now I'm going to kind of give you just like a smattering of ideas. My therapeutic approach is really a melting pot of all of these. So I'm not like specifically in one camp or another. And of course, I tried to, for organization and clarity, separate them, but there's so much that overlaps and integrates between the different styles. So you'll see that there's a lot of similarities in some of the ideas that I've presented. So it's not like one is only an arts therapy and only a CBT approach. So within ACT, if you Google Katie Gore ISAD, the International Stuttering Awareness Day 2015, she wrote this awesome blog that could, again, be a whole series of lesson plans for you that's really focused on experiential learning through voluntary stuttering. So we know that voluntary stuttering, or encouraging our client to stutter on purpose, helps with desensitization and moving away from that black and white of stuttering is bad, I'm trying to avoid it at all costs, to I don't know, you can control, maybe you want to stutter. Let's stutter on purpose. How can you do it a little bit differently? So she walks through the ACT framework of this experiential learning opportunity, first where the therapist is going out into the wild and voluntarily stuttering, and the client or student is just observing. So through the ACT lens, you're thinking about the present moment in which the client is watching the other person's reaction to stuttering. You're thinking about values and committed action, that the person who's speaking is saying what they want to say, and you might want to plan where the voluntary stutter is going to happen. Self is context, so you're just evaluating the interactions and discussing them afterwards. Diffusion, talking it out, reframing thinking and negative patterns that might come up, and separating yourself from the discomfort or awkwardness of the experience, accepting that things will be okay, you survived and you did this, and walking through it in that manner. She goes into so much more detail, which is really, it's an awesome blog post. Avoidance reduction therapy, a couple of ideas. So holding on to the moment of stuttering or stuttering for longer. I love doing this with kids, and they're often met with like, what? Why? I'm trying to make this end. Why are you going to make me do it longer? That's strange. But again, like building in that flexibility of how we think about stuttering, challenging them to show their stuttering to others. That's kind of like voluntary stuttering, just like putting it out in the forefront. Discussions about escape behaviors and how that might lead to more struggle. Self-disclosure, teaching others about stuttering, the kind of classic class presentation about stuttering. And fear hierarchies are a big one. So this is just an example of a fear hierarchy. So simple, so quick and easy that I walked through with a tween, early teen, in thinking about comfortability. So within the arts framework, they think a lot about challenges and like challenge activities. So when you're crafting a challenge, you want to think about actions, behaviors, and values hierarchies, right? So we have this fear hierarchy here, which happens to be kind of situational or context driven. But you could also think about fear hierarchies of different people, fear hierarchies of linguistic situations. Is it more feared when I have to say a really long presentation or versus like just saying a few words in class, and being really specific about the client's experiences and really like granular about all these different steps can help you find the places to push that comfort zone just a little bit at a time. So you want to be thinking about small and reasonable steps that you can propose that are realistic, right? We're not jumping too many steps, and thinking about how often you're asking the person to do it or the context in which you're asking to do it. Ultimately, trying to set them up for success, right? Because we don't want to suggest a challenge that's going to be too difficult. But if it is met with a barrier, then your next step is just to talk about what was that barrier and how can we potentially remove it the next time. So again, thinking about specific situations for the individual and their environment and crafting a really granular fear hierarchy can help that. These are just a couple quick examples of challenge assignments that obviously were specific to the individual, but that's what I mean by a challenge assignment. And this is just a quick educating others about stutter, thinking both about like how stuttering impacts me and what another person should do. So building that self-advocacy. This client was 5. So thinking about really like at a young age, how can you advocate for yourself and your voice? Okay, so CBT, this is the stuttering iceberg that we talked about, identifying and modifying unhelpful thoughts that might distort reality. So questioning and examining facts, right? So do you have any data to support that idea? Can you go out this week and can you collect data about how many times people laugh at you when you stutter, and actually have a number on it? Because as humans, we tend to magnify our negative experiences and to latch onto those, but having the data to actually really play around with, was that a valid representation of what actually happened, and helping to encourage that cognitive flexibility to consider other alternatives or causes of an event, walking through what ifs to help visualize and prepare for feared experiences or feared consequences. This is just a quick example of a stuttering iceberg I did with a client. This is a CBT cycle where you walk through the thoughts, feelings, and actions. So this, I think she was 12, stuttered during a presentation. What was the thought? I need to get the word out quick. What was the feeling? A little anxious. What was the action? I said it, actually mouthed it out, practiced it first to get the feel of it, and it was pretty effective. So walking through times, both that felt successful as well as maybe the times that didn't feel successful, and thinking about what the differences are between those, and how maybe you can craft more success in an alternate opportunity that first felt unsuccessful. This is just another visual of kind of thinking through the thoughts and feelings related to stuttering. And this again was a 6-year-old at this point, thinking about, all the beneath the surface that's going on and helping work through reframing those thoughts to a more positive association with stuttering. So mindfulness, I gave some strategies before, and I love Insight Timer. It's free. It has a ton of mindfulness meditations. It even has some specific to stuttering, which I would only recommend for adults or like teens, but they're pretty cool. And Smiling Mind is a good one for younger kids. I'm not going to read these, but these are some journaling prompts, which you might want to build in as perhaps a challenge activity. And that workbook that I've linked there, if you Google it, was like $5 or something. And it has over 500 stuttering specific journaling prompts, which I think are really great, either discussion points for like a verbal conversation, or it could be a journaling home activity. So then SFBT, Solution Focused Brief Therapy, walks through these different kinds of questions. So asking clients to consider signs that their problems were solved, or describing differences from when it was more or less, asking clients to clarify what they want their outcomes to be. Again, all focusing on building their own self-efficacy to solve their own problems. So I didn't include this slide in your handout just for like copyright purposes. But again, this article is freely available. And if you can't find it, I'm happy to send it because it's awesome. There's like 6 pages of the appendix that just give you all of these therapy plans. So this is a example of a scaling questions. So you just have a simple Likert scale, in front of you and the client, and you're asking, where on the scale are you today in terms of achieving your best hopes? What point in the scale would be good enough for you? How will you know you've achieved your best hope? And you're really working through this in a systematic way and diving pretty deep. And I think when we think about outcomes and how we're moving away from fluency-based outcomes and towards confidence and communication-based outcomes, scaling exercises are really important to build into our measurable goals, because that's how we can show progress and advocate for services. So I really like embedding scaling questions and scales into my work. So then stuttering affirming therapy, again, the article I referenced before has a ton of discussion questions, but you might start with asking the client, how would you stutter if you were comfortable stuttering? If you liked stuttering and wanted to stutter? What does stuttering do for you? What would you lose if you were fluent? What do you gain by stuttering? And it's one of my favorite questions to ask, and the answers vary widely, and it's pretty different across ages. If you ask a littler kid versus an adult, what do you gain by stuttering? It's pretty clear how much time and stigma impacts the adult's perception of stuttering versus asking a child. So I think if you're working with children, it's a really great opportunity to embed this mindset early on and maybe prevent some of the future trauma and negative self stigmatizing thoughts that come with stuttering. So you can think about catching moments of stuttering without changing them, just like it happened and we're not doing anything about it. Show me how to stutter like you, define confident and competent communication. And this workbook by Kemla has been out for a while. It's published by the Stuttering Foundation, is really great at helping to support a positive self-assessment of the person as a stutterer. So this is just a quick screenshot of an 11-year-old client who I was working on, and this is his definition of confident and competent communication. It involves eye contact, being a sociable person, getting my point across without doing loops or going around my point, being able to listen without feeling the need to speak, interrupting or finding openings to make my point. There's less of an emergency to get my point across, and I can focus on being a good listener. And I feel physically at ease, like less fidgeting, less tension, less tired from speaking and forcing. And that was at 11.
Hey,
This was,
Caroline.
yeah,
Sorry, can I jump in with a quick question? Some people were asking about what to search for in that article you were talking about. I think on the last slide, or right before this, there was an
this
article.
one.
Yes,
So
this.
Ramos Hendricks is the author. Solution Focused Brief Therapy for Stuttering in School Age is the title of it. And in one of my first slides where I go over SFBT, I have the full name of the article there, but it was just earlier in the presentation.
Okay, perfect. Thank you.
Sure. Um, so this was a preschooler. The double high five comes from Kemla's book. So it's just 10 things that you're great at and that make you you, building a positive sense of self, and perhaps spending an entire session talking about things other than stuttering to just value the client as a person beyond just their stutter. Okay, so running short on time, I'm going to go through quickly this progress monitoring. As I mentioned before, I think we want to think about different ways to monitor progress because we're not just doing an SSI and a stuttered syllable count. I actually don't do the SSI anymore, but thinking about the OACs or some of these other scales to measure different changes in behavior using scaling exercises to measure those changes. So these are just here for your future reference, but I would highly recommend having the OACs and the different age levels of the OACs if you don't already. So this actually was in the chat earlier, and I think is so important and could be its whole own discussion. But what do you do when there's a mismatch with the parent perspective, right? Like you're working from this lens and you understand the value of communication. How do we communicate that with our parents who just want the stuttering to go away or for them to be more fluent? So Anna Paula Mumi just put this statement out. She said, I thought it was beautiful. We must educate with patience. We must empathize with grace. We must listen with understanding. We must care with genuine concern, but we must also gently bring parents to accountability. So it is our role to shape parent insight and approach to stuttering and to be part of that broader social change. And as opposed to just having the locus of change on the individual who stutters. That first YouTube link is from the Spiro Stuttering Foundation. So this Anna Paula Mummy's company and is a really great parent educator YouTube that you could send to any parents. And then that blog post is also an awesome blog post from Katie Gore about stuttering therapy and stuttering acceptance. Just mentioning in terms of parents, I always start with a solution-focused parent interview towards the beginning of the therapeutic process. I know in school settings, it can be challenging. You don't always have that much parent interaction, but if you're able to, I would highly recommend it. And if you look at these first questions, what are your best hopes for your child? Often you might get a parent coming in and the first thing they say is to be fluent, to not stutter anymore. But by asking the four what else's that follow it, you can kind of peel back the onion and find underneath that maybe it's really just that they hope for them to be happy or they hope for them to be successful and to be not met with struggle. And that's so much more of a workable place than just striving for fluency. So I think this is a really great way at kind of getting on the same page in terms of vocabulary with parents. And again, Palin could be its whole own presentation, but you can see the link on the bottom there. The Michael Palin Center for Stammering.org has a ton of awesome parent caregiver resources and just ways of thinking about working with the caregivers on this same kind of lens. So I recommend looking into the Palin Center's resources. There's a ton of free stuff there. And just to kind of conclude to say, this is really hard and change isn't linear. So this is a picture of just like the spiral model of the stages of change. There's going to be setbacks and there's going to be progress, and just know that we're kind of doing good work. And in our last 2 minutes, I'm glad I saved enough time for this. I want to just share.
I stutter a little bit too, so that's why I'm in speech class too.
So what kind of things do you and I talk about?
Well, sometimes we talk about, like, I went on a trip earlier today, and not today, like a few weeks ago, and we can talk about that. We can talk about like our days. We can talk about like anything you really want.
And so what do we work on? How are we like working on speech?
On speech, we're working on tools to help you not to like struggle so much. For I sometimes struggle with like bumping or sliding, and so that's why we have tools for those. Is when I get too tired of like keep doing it, I can pause and take a deep breath and restart and just like calm myself down. That's one of them.
And so is stuttering a bad thing?
No, it's not a bad thing. Some people can stutter, and as like speech teachers, you go to speech teachers and they help you not to struggle with them. And stuttering is not a bad thing. It's just like how people are born with. They have to stutter.
What's a good thing about stuttering?
A good thing about stuttering is like it makes you unique in like yourself, I think. Unique is like everybody should be like a little bit different, but also like a little bit same. But like being a little different than other people just makes you like unique and different and nice.
Awesome. So I love that video so much. She is 7 and you can hear her voluntary stuttering without any, obvious associations with that. You can hear her talking about not struggling, and how stuttering is not a bad thing. And it actually is something that makes her unique. And I think it's just a really beautiful example of what, I worked with her for about 2 years, what this approach can do to just change mindsets, and instill this, move towards
I stutter.
communication. So I'm totally out of time for questions, but that's my email. And again, I'm happy to share any of the articles, answer any questions. I can also stay for about 15 minutes if people want to stay after to ask me anything. I know it was a lot of content, but I really appreciate everyone's attention and engagement with it. So thank you.
Thank you, Caroline. Awesome. We'll just go through a few Q&As that people have put in the chat. Somebody asked about in the beginning, could you go over again when you were talking about the spelling of dis, you were saying DIS versus DYS. Could you go over that one more time?
Yeah, so just like in spelling in the world, the way the prefix works, DIS is a typical variant and DYS is disordered. So Evan Usler, Usler, has actually published a bit on this in his discussion about fluency. And so I think it's a really small but mighty change that can be made to thinking about DIS fluency as just a natural variation in fluency versus a disordered DYS fluency.
Wonderful. Thank you. Someone asked, at what point do we co-treat, collaborate with school counselors and other mental health professionals? I want to stay in my lane, respecting the limits of our scope of practice and recognizing the complexities of stuttering.
Totally. It's so hard. I think that, it kind of depends on the system that you're working within, but really awareness of like our lane is how this how the child's life is impacted by stuttering and how stuttering is impacting their life participation and engagement. And that might pull in a little bit of anxiety or social anxiety, but if it starts to move beyond the communication environment and more broader anxieties, I think that's when you really need to get another mental health professional involved because it's moving beyond our like stuttering scope and into more pervasive influences on behavior. But it really is a gray line. And I think, if you have access to psychologists and mental health counselors, that the earlier the better to just have, a consultation or discussion about what might tip the scales for that particular client, especially when they're kind of in that teenage age. And, you can start to pull in some of the other emotionality that can be really challenging.
Another person asked about strategies or I guess best approaches for young children. I'm assuming they're meaning like preschool. Is there a specific strategy or approach that you think is best for that age?
Yeah, I love the Palin Center for that age. So that's kind of your number one resource. It's really there. So it's tricky because I would say that this presentation was largely geared more towards like 7 plus, maybe 5 plus, because there is research that shows that in that like 3 to 6-ish range, there is the potential for spontaneous recovery or for stuttering to not persist. So there is some support that working with those strategies might lead to longer term fluency, which is not supported in the literature for older students and adults. So that's why it's a little bit more gray. And there's more emphasis on kind of the speech motor awareness and working on some strategy support. But I think the Palin approach, which I really love, builds in the whole family systems and is really working on how do we shape the environment and provide, again, that social model context, the best supports in our environment, and not just make this all about what the child needs to do or say or how they talk differently. So I think their resources are really excellent.
Perfect. Let's see. Someone asked if a child does not have an issue with their own stuttering themselves, but they are recommended by a teacher to screen for speech therapy, what would you recommend?
So the child was recommended by a teacher, but is not seemingly aware or bothered by it. I think then, it's an interesting question, right? Because this my proposition of stuttering being what is identified by the speaker, not by the listener, would say that maybe you're not picking up that client. I wouldn't just off the bat, dismiss it, but would have more than a single session, like a more thorough intake or evaluation process in which you're looking at, in a very systematic way, the broader effects of stuttering. So their awareness of their communication. Is it something that they know that they're doing in the first place? Does it have an impact on how they're participating, thoughts and feelings and emotions? The behavior assessment battery is another really great one for the school age. It's kind of similar to the OACs, but it looks at specific like thoughts and attitudes towards stuttering, as well as situations that may be more or less feared, as well as different behaviors that they might do in an effort to try and fight or force words out. So I think just making sure you're really canvassing the whole experience of stuttering so that you are honoring what the individual wants and needs at that point in time. And it may be that at that moment, this is not what they need, and you feel like you've done your due diligence, but you're not picking them up for the therapy caseload because it isn't impacting them and their participation. And so you might be doing a little bit of broader like school education and kind of teaching the teacher or the classroom system about the social model, showing that John Hendrickson video that like we also as a society can just be more patient and listen, and that it's not necessarily that person's job to change if they're not feeling truly impacted by it.
Great. Another person asked, if a client insists on reducing stuttering, which approach do you find most beneficial, or is it totally client dependent?
Yeah, I think that I mean, my like gut is to say kind of working in the cognitive behavioral realm, because likely that insistence on stopping stuttering is coming from deeper fears about what stuttering might mean, right? So if I stutter, what's going to happen and what's the worst case? So kind of probing through what would happen if you stutter, why do you want to stop stuttering? And trying to see if you can increase that cognitive flexibility, break some of the black or white thinking, or just be a little bit more flexible in their approach. And maybe can we move from never stuttering to stuttering less or stuttering more easily, or can we decrease it by 10% or 20%? And then like, what's going to be good enough for you? And being really realistic, depending on their age, about the likelihood of magically waking up and never stuttering again. The older you are, the less likely that is. And I think it's hard, but an important kind of dialogue to have.
This question is kind of similar to the one you answered just a minute ago, but it says, what approach would you recommend for students who are not aware of the stutter?
Yeah, so I think building awareness and using kind of mindfulness approaches at the start is great and can be really fun. I typically, depending on their like engagement with it, and usually with younger kids, I spend a lot of time pseudo stuttering and stuttering myself, and we make it into a game. So, I want to see if you can catch me stuttering and like see if you can like find it, pull it out of the air, or like add a tally mark on the board or whatever it is, and have it be play based and fun. And so their reward is like, you got it, you saw me stuttering. Like I want to see if I can do it even bigger. Do you think I can make it even longer? And so you're starting to kind of like playfully tweak this idea of stuttering is something that I'm supposed to be hiding and not doing, to like, oh, this woman is stuttering on purpose and like she's trying to stutter. And like that seems kind of fun, to through a playful lens, encourage them perhaps to try on some stutters or to voluntarily stutter, and then eventually maybe move towards their own self-awareness of true moments of stuttering.
One person asked about the evidence base for SFBT. You might have included some of that in the links that are in your presentation, but I didn't know if you had any additional information about evidence for SFBT.
Yeah, so it's definitely newer in its application to stuttering. So there's a great evidence base in the field of psychology in particular, and working, from with psychological issues and from that approach. But its evidence base for stuttering is being built. There's a really great resource by Ali Burkez. She just published a book, SFBT, for school age children. Let me see if I can quickly find it and put the link in the chat. And she's out of the Michael Palin Center, actually, has been doing some great work. So I'm looking for that at the moment, but you can ask me another question if you want.
Let's see. The last question we have in the Q&A box is about if you could show that slide with you had the kid's handprint again.
Sure.
She was interested. She said, "Could you please show two slides again, the kid's handprint and the one right before it?"
Yep. So I just put the SFBT book, which is amazing, super practical, applicable. If you're into that approach, it's worth it. And now let me find my slides again. Okay, so you asked me to share the hands one, so this, it's called The Double High Five. It comes from Kristen Kemla, Chemla. Her book, I mention it up here, Working Effectively with Attitudes and Emotions for School-Age Children Who Stutter. And so it's really just, a tangible way of looking at things that make you you and things that you're great at, and not super focusing on stuttering. And then what was the other one you said?
I think she said the one right before it, like what
Oh,
you were going over, what you were talking about here.
yeah, so this was defining competent communication. So I think, again, in our shift away from stuttering, and if you ask a kid, why are you in speech therapy? Because I stutter and I'm going to try and stutter less. Can you teach children what communication means? And what does this word competent or confident mean for you? So what does it mean to be a good communicator versus just a person who doesn't stutter? So again, breaking that kind of binary and being more descriptive about it. So this was this 11-year-old's description of what competent communication means for him, including eye contact and being sociable, getting your point across and being more at ease. So I think you really can work on defining those concepts at a pretty early age.
Great. Well, I think that was everything in our Q&A. So thank you so much, Caroline, for sharing your knowledge with us today. Please remember, if you would like to earn Ashes CEUs to complete the assessment with a score of 80% or better, it will remain open for 1 week. You will be redirected to the assessment when this webinar ends, and you will also get a link to the assessment in the email that will go out 24 hours after this email ends. So thank you again, Caroline, and we hope you all will join us for another Able You again very soon.
Thank you.